experience from different experts from different angle of the world in terms of immunization in order to achieve a AI 2030 immunization agenda. Thank you so much.
All right, a warm welcome from Geneva, Switzerland, Ebolova, Cameroon, and from Nigeria. Of course, we're 1 minute away to this official launch event. Nigerian health leaders have been working on developing this immunization collaborative over the last 8 weeks. We've been working together, and today is the day of the launch. We're very much looking forward to this with Charlotte Mbu. We are 45 seconds away from starting, and we cannot wait. We already see many of you who are across our social media, and in particular we had over 700, I believe, people registered to attend on LinkedIn. If you are watching from LinkedIn, please do let us know. There is a slight delay, but I can see there are already messages coming in. Please don't just send your greeting, tell us who you are, where you are connecting from, and tell us why you are joining the collaborative. You're going to see the first question we have for you is actually, can you explain the collaborative in one sentence? Right, a warm welcome from Geneva, Switzerland. I'm Reda Sadki. I'm here with Charlotte Mbu. We're both from the Geneva Learning Foundation and proud to be hosting this special event, this launch event in partnership with UNICEF and the National Primary Healthcare Development Agency of Nigeria. Now, a word to explain what is going to be different about this event. And first of all, we do want to warmly welcome, thank, and honor our distinguished guests from state, federal, and international partners. But we're placing the spotlight today on those at the heart of our mission, and that is, of course, health workers serving local communities. We just want to share a few of the introductions here before we go any further. So today is the launch event. We're going to kick off with a question that we have asked before. It's always interesting to see how what the responses are, and we're asking you to explain what is the collaborative in just one sentence. Our first speaker is going to be Lawan Umar. Lawan Umar, over to you to tell us. Do not forget to introduce yourself. We're now live, so looking forward to hearing from you. If Lawan is having problems with connectivity, then we will go to Rama Abubakar. And I see that.
Lawan is muted, brother.
Okay, wonderful. Lawan Umar, please introduce yourself and tell us what is the collaborative in one sentence.
Exactly, sir. My name is Lawan Umar, a physiotherapist working in Federal University of Health Sciences, Algeria. And then I have an experience in participation in things that does with immunization, vaccination, and what have you. So my take is that collaboration is the process of two or more people. That means more of us coming together as an organization, as an individual, to complete or achieve a task of having more vaccination, improve a reduction of vaccination in the context of immunization in Nigeria. Thank you, sir.
All right, wonderful. And then next, I don't know, Charlotte, if Rama Abubakar, who was scheduled to speak next, is still in the studio with us. She may have been disconnected, in which case we'll go to Maria Mustafa. Maria Mustafa, we'd love to hear your answer to this question, and of course, for you to introduce yourself. Please, a warm welcome to you.
Okay, sir.
Yes, please introduce yourself and tell us what is the collaborative for you in one sentence.
Okay, so I remain Maria Mustafa from Kano State. I'm in the Kano Teaching Hospital, Department of Community Medicine. Collaborative in one sentence means joining hands to fight against something or achieve a common goal or a common task against something.
Thank you very much indeed.
This is what it means by collaboration.
Okay, wonderful. Yeah. And we've got...
Thank you, sir.
Thank you, Maria Mustafa. We'll hear from one more person if Ismaila Mohammed Usman is ready to hear again. What is the collaborative for you, Ismaila, in one sentence? Ismaila Muhammad Usman, we're calling on you. We want to hear your voice. This official launch event is about your voices, your experiences. Please go ahead.
Good evening. I still remember my humble self, Muhammad Usman Ismail. Collaborative in one word or in one sentence simply means cooperation. It is a union that brings people together to achieve a goal. That is what collaborative is all about. It talks about unity, union that brings people together so that all our ends, our mouth will be one, so that we'll be able to achieve whatever goal we tend to achieve. Thank you very much.
Wonderful. Thank you very much, Ismaila Muhammad Usman. This is how we kick off this unique launch event. And we're very pleased and honored to present today as part of the launch event the first collection of experiences shared by you, shared by health leaders from all over Nigeria, 270 health workers across the country from, I believe, nearly every state who took the time to share their experiences. I'm going to show you what it actually looks like. You can go right now and go download this collection. These are your experiences, and when you go to the page, to a website called Zenodo, which is where the experiences are hosted, you scroll down, and down here you will see there's the complete collection. There's so much. There's, of course, recognition and honor for the contributors who took the time to respond to the questions that we shared. And then if you keep scrolling, you will see that there are many, many experiences shared. Charlotte in our Insights team has been reviewing what Nigerian health leaders at all levels of the system across all organizations have been sharing in terms of these experiences. I believe there were two questions. Charlotte, can you tell us what question number 1 and question number 2 are?
Yes, Reda. So question number 1 is really about an experience where you were able to use a new or creative way to solve a problem in your community, like people not wanting vaccines or having a hard time getting to the clinic. And so what happened and how it turned out, and we got some very interesting responses. Question 2 was really focusing on why you want to join the Nigeria Immunization Collaborative. We have been asking some of you these questions, and so be ready to answer both of them when the time comes. Thank you, Reda.
Wonderful. Thank you very much indeed. We're now going to go back to our guests of honor, those of you who are in our Zoom studio, to ask this question. What is the biggest immunization challenge that you face? And also, why haven't you been able to overcome this challenge? And those of you who've been following, who are already part of the collaborative, know that this is only the first why. But let's start there. Let's lower everyone's hands, and then we'll please, if you are watching from YouTube or LinkedIn or anywhere else, please, you can answer this question in the comments, in the chat. If you're on Facebook or Twitter X, wherever you are, please take the time to respond to this question. There's a little bit of a delay, but we will try to show your responses as well. Charlotte, I've lowered all the hands in our studio, so we're now looking for our first volunteer to explain what is the biggest immunization challenge that you face. And again, we are less than 24 hours now from starting the collaborative's first exercise focused on finding the root cause of your immunization challenges, the root causes. Charlotte, who shall we hear first?
We have the first speaker, that is Mohammed Nasir Umar Reda. Mohammed, your hand was raised. Are you able to unmute yourself? If not, we'll go to Mary Gloria Orji. We have quite a number of hands raised, so I'm giving you all the possibility.
So Mary Gloria, a warm welcome to you. Please do introduce yourself and tell us about the biggest immunization challenge that you face in the community where you work.
Thank you so much. My name is Mary Gloria Orji, and I am the President Network of People Impacted by Cancer in Nigeria, a breast cancer patient actually, and a patient advocate. And I joined during the HPV vaccine. I was trained on advocacy for people to accept this. And one of the greatest challenges that people does the trust trust on the vaccine was so low. A lot of people felt that it was a way to harm them. And the environment, we tried to go through the traditional rulers. Even at that, when it comes to families, it was now a problem. We were able to convince some, but some of them, when they get home, their husbands will say, no, you don't do that. My daughter, this will stop my daughter from being fertile. A lot of things that we were hearing. And countering it is not easy. And even the social media is not even helping us at all in countering it. So it's quite huge, and we've not really been able to solve that much, but we are still on it, trying to see how we can get the religious bodies, the traditional rulers, and even make an inroad, maybe more awareness in the various social media channels and the traditional media channels also to, kind of counter all the misinformation that is out there. Thank you.
Mary Gloria, I have a question for you then. Have you tried asking why, and then each time you answer why, asking why again, and doing that 5 times? Have you tried that yet?
I tried that. Yes, I did.
All right. And can you tell us, did you find the root cause different from what you initially said?
Yes, I did.
All right, wonderful.
At the end of it, I found out that the root cause is misinformation. There's not much education on the HPV vaccine. I think that's why there's a lot of resistance to the vaccine.
All right. Well, thank you very much indeed for having you already ahead of us for the root cause analysis exercise. We look forward to seeing you tomorrow for the first session in which you'll be really working with colleagues from all over Nigeria. Thank you very much, Mary Gloria Orji. So, first we want to share the following number, which is the number registered for today's launch event. 3,443. Now, most registered are those who are working for health in Nigeria, working for immunization, but not only. In fact, we saw many health professionals from other countries, surrounding countries, but also from Asia and Latin America registering for the launch today. So we're very proud to welcome you all, whether you are from Nigeria or from another country. So warm welcome to everyone. We have more of the root causes. We're sorry, there's simply too many messages to be able to show all of them, but we're trying. Biggest challenge is language barrier. Bashiru Maidama, we're happy that you're happy to find yourself in this important meeting, but tell us, what is your immunization challenge, and have you started to do the root cause analysis? Like Titilayo Akinpelu, who says presently in Nigeria, the root cause is people believe so much in pluses and they think immunization is from the government, not from the NGOs. So, of course, we'll be countering all kinds of misinformation during the collaborative. Boma Otobo from Oyo State, working at state level and happy to be part of this. We just have so many responses and messages, Charlotte. And Akitunde, we agree, it's great. And we hope that it is only the beginning. Now, on June 23rd, if we go back a little bit more than 5 weeks ago, actually, only 23 Nigerian health leaders had shared the information about the collaborative inside the across Nigeria with their colleagues in Nigeria. And initially, we reached a significant but modest number reported by Nigerian movement leaders of 29,945. But then this increased as we went across the successive weeks. And this is what we're going to look at now. We jumped to 44,945 by the 1st of July, 56,195 by the 8th, 65,320 by the 15th of July. And the number today for the launch event is that Nigerian health leaders in the movement for Immunization Agenda 2030 reached an amazing 81,854 of their colleagues. This is what you told us. We believe you. And in fact, we want to acknowledge now the 123 who have reported and taken the time to tell us who they shared with and how many people they shared with. So we do want to do a little bit of a sequence here where we acknowledge exactly that. And we hope that those of you that we're honoring in this way will see your name. We do have to scroll very fast because we have so much more to do in this launch event, but we did want to acknowledge, recognize, and honor those of you who took the time to share. It's one click, but it's something. It is significant. And the number is that for every 23 reached, one person expressed interest. Now, just a reminder, the Geneva Learning Foundation is organizing this peer learning exercise. The peer learning exercise starts tomorrow, and this is in support of the Nigerian Movement for Immunization Agenda 2030, that's IA 2030. And of course, we're working together with the National Primary Healthcare Development Agency, NPHCDA, and UNICEF. What is this about? I'm going to ask Charlotte to answer that question.
It's about all of the children in Nigeria who are not receiving the vaccines they need, and reports show that 400 million children miss out on vaccination yearly. So we thought that it was important to connect with frontline health workers who can come together to try to help the country do better as far as immunization is concerned.
Thank you, Charlotte. And so we're very pleased, as we said, we dispensed with many of the formalities because we're eager to hear your voices. We do recognize and appreciate all of our partners, starting, of course, with the NPHCDA and UNICEF. We do want, however, to introduce our guides on the side. And so these are Nigerian and global experts, subject matter experts, immunization experts who have kindly accepted the invitation to join the collaborative as guides. And the guide on the side is different from a sage on the stage. Charlotte, I'd like to ask you to take the time to read their names so that we may properly recognize them.
Thank you, Reda. So we have Boma Otobo. We have Chijoke Kaduru, that's actually here in the panel with us, as well as Dr. Ikpeze Odingoma, Dr. Onubogu, Dr. Tokumbo Oshin, Dr. Homsuk Swomen, Dr. Ibrahim Dadari. Reda, the comments actually are shading some of the names. Okay, thank you so much. Dr. Abdul Mumim Saad, Jenny Sequeira, that most of you already know, Professor Rosemary Ogu, Scholastica Njagi, and Viviane Ehekweazu of Nigeria Health Watch. Thank you, Reda.
Yeah, so we do want to thank these exceptional leaders for accepting the invitation to contribute to the collaborative. Now, there is one more group that we will honor, and we're not going to do it today because it's special enough that we are going to wait and do a separate announcement. And if you attended the assemblies that have taken place in the preceding Mondays in the last 8 weeks, you will be recognized as a co-founder of the Nigeria Immunization Collaborative. So we do want to already, and you know who you are if you are in the Zoom studio with us or wherever you may be online watching this, you know that we recognize and appreciate the commitment that you have shown over and over in supporting a number of different initiatives. So we look forward to sharing that list next Monday. Now, before we go further and before we go back to the voices of members of the collaborative, actually, Charlotte, shall we go back now? I see many hands raised. I think that it's time to hear why, from those of you who are here, and of course we're starting tomorrow, why you want to join the Nigeria Immunization Collaborative, and then we'll present the organizations that have become partners of the collaborative. So back to you, Charlotte, to select our next speaker.
Thank you, Reda. So, Mary Gloria Ochi, you have all received a prompt to unmute yourself. So if your hand was raised, so just go ahead.
I think we just heard from Mary Gloria.
Yes. It was actually Albert Colli Fiezier. Okay, Albert, over to you.
Good day, everyone. I really want to appreciate for the time and the opportunity given unto me to speak to the worldwide. Okay, first and foremost, I would like to contribute to the aspect of where we feel in terms of community and engagement and accountability with the community health. Community health.
Sorry, Albert.
Traditional ruler.
We have a very specific question for you, which is why you wanted to join the Nigeria Immunization Collaborative.
Okay, one of my basic reasons why I joined the community immunization collaboration is based on the fact that I really want this immunization to spread across these rural areas in this part of the country, most especially in the south part, because whereby most persons they feel reluctant of coming down here based on we are much of riverine areas.
Understood. Thank you, Albert. And now tell us what you had in mind. I know you have, you may have already started to work on your root cause analysis. What is the biggest immunization challenge that you face? Oh, I think we've lost Albert. So let's go to Wahid Adeyemi Adeyanju. Oh, no, okay, Albert is back. Go ahead.
Oh, good morning. Good evening.
Yes, go ahead, Wahid Adeyemi. Tell us, introduce yourself.
My name is Wahid Adeyemi Adeyanju from Oyo State, but not local government precisely. I've joined the immunization group since COVID-19 time. I was able to work also, join through the HPV that just concluded just of recent. And I'm my local primary health care at Agboy in Oyo State, Ibadan.
And so tell us, why do you want to join why have you joined the Nigeria Immunization Collaborative? Okay, and I think we've lost. So don't mute yourselves because we probably have questions for you again. But I think it is time, Charlotte, that we actually introduce the organizations that are supporting the collaborative. And there's a remarkable number there. Remember that we'll be honoring the founders of the Nigeria Immunization Collaborative. It's important enough, significant enough an announcement that we're not doing it today. But here are the partners. And again, on the 17th of June, 12 organizations had expressed interest in becoming partners of the Nigeria Immunization Collaborative. And just to be perfectly clear, the way this works is someone from the organization who is authorized to represent the organization basically tells us we want to be partners. We're now going through the process of actually formally confirming through letter of endorsement what each organization is committing to. So we're very pleased to introduce the following partner organizations. They were 166 last Monday, and today 193 partner organizations. This is a wide range of organizations, from civil society organizations that are very small, focused on the local community, to large organizations that are at the state or federal level, and a wide variety of organizations. Our commitment is to recognize local government agencies alongside civil society organizations and other types of non-governmental organizations. But we want to celebrate and welcome these organizations to the collaborative. We have, again, an ongoing process to select and explain, select and confirm the endorsement. In some cases, you'll see more than one organization. And of course, we always show the name of the person who committed, who said that they were authorized to commit the organization there. So these are our organizational partners. If your organization is not yet a partner, do complete the partnership form. It is not too late, and then we will ask you to sign and disseminate a letter of endorsement. Now, Charlotte, we're going to go, just a brief reminder, you're going to remind us who the Immunization Collaborative is for.
The collaborative is for all health workers in Nigeria that want to make sure that all families are protected from vaccine preventable diseases. So it's not about your job. It's not about your job role or organizational affiliation. It's really about making a difference for the children and families of Nigeria.
And what are the challenges where, if you face any of these challenges, we especially wanted you to join the collaborative that will be starting. The first learning session is going to happen tomorrow with Nigerian health professionals from all over the country coming together. But what are the challenges that we're especially concerned or interested in?
We have children who have not been vaccinated or who have missed their vaccines. We have outbreaks of vaccine preventable diseases like diphtheria, like measles, like yellow fever. We have people in the community who do not trust vaccines. We have had to reach remote rural communities or communities that are in conflict. We have barriers that make it hard for some people to get vaccines.
And what about the groups that are particularly affected or that we're particularly interested in? Can you tell us who those might be?
People who work in remote, rural, or hard-to-reach areas, people that are in poor people in cities, in urban areas, people that are affected by conflict, people who move around a lot like nomads or migrants, and then we also have refugees or displaced people who had to leave their homes. So if you work with any of these groups, you are encouraged to join the collaborative.
Thank you, Charlotte. And now, if you're listening to this, I would like you to go to the chat window. So if you're in our Zoom studio, that's easy. If you're on YouTube or Facebook or LinkedIn or Twitter, go to the comments and type yes to let us know if you face any of these challenges or work with any of these groups. So Helen Kolo is the first one to say yes in our Zoom studio. All right, there are too many names going by too fast for me to be able to recap and follow. I'm just going to show. And if you are on social media, we know there's a bit of a delay before that before you hear us. So, all right, I think. And do more than just introduce yourself. Tell us what is your immunization challenge and what you are doing next. A quick reminder, you can still join the collaborative. We ask you to share the call to action, complete your application, and then attend the next Monday, but you'll receive instructions actually for tomorrow. Now, we showed you the first set of experiences shared. I'm going to go to them here. Shared experiences. So this is a collection that is available starting today, and it is 270 health professionals from Nigeria who share their unedited, raw, unscripted, unfiltered experiences. We, of course, recognize and honor these contributors to the Immunization Collaborative, and you'll find the full list of names has been shared already with everyone participating in this event. Charlotte, I believe it is time that we move to the first question. And this is actually a set of questions, but really we asked you, can you tell us about a time when you tried a new or creative way to solve a problem in your community? So these are just examples where you actually were able to make progress, people not wanting vaccines and then going to accepting vaccines, or having a hard time getting to the clinic and then you found a way to help them get to the clinic. We'd like to ask you to tell us what happened, what you did exactly, what words you used, what things exactly that you did, you carried out, and how it turned out. So to get that started, we'll now ask for you as volunteers. I see James Ode David is already unmuted. James, are you our first speaker to respond to this question one? Please do introduce yourselves, and you can also tell us what your challenge is. Okay, Esther Ogunwa Chinedu, the floor is yours. Are you able to hear us? Esther?
Hello.
All right. Okay. Can you speak very close to your microphone, please, Esther? Right now, we cannot quite hear you. All right. Esther, I'm afraid that we're not going to be able to hear you, but we have Matthew Ogonaya Chukuma. Matthew, please go ahead. Can you tell us about a time when you tried a new or creative way to solve a problem in your community?
Oh, thank you so much. Good afternoon, everyone. Yes, back then in my state, my boy state, there was a time that a lot of people from the UNICEF came for immunization. A lot of parents refused taking the vaccine. What I did was to talk with the chair lady the person in charge of the woman leader in the community. And she came, I explained to her the need for people to take the vaccine. Which she championed, she talked to them. She even had to organize a quick meeting for the women and tell them the need for them to for the children to take the vaccine. And seriously, they all listened to her and then accepted the vaccination. And I was glad that happened. Thank you.
All right. Thank you very much indeed, Matthew. I wasn't quite able to hear. Charlotte, are you able to recap exactly what happened? I hope your ears are better than mine, and I believe that they are.
Not really, Reda. There was a bit of background noise, but it was really about encouraging a vaccine acceptance, though I wasn't able to capture all of the details.
Okay, thanks, Charlotte. And so, just to say before our next speaker, I believe Kafayat Raji is going to speak next. But Kafayat, remember, we're looking for something you actually did. So it's not just your opinion that there is vaccine hesitancy or that it is bad, but it is a time when you actually did something different and that helped solve a problem in your community. Go ahead, Kafayat. The floor is yours.
Good afternoon. I'm Kafayat Raji from Ibadan North Local Government, Oyo State here. I'm in nurse working with the local government and at the same time the health educator for the local government. Yes, something I did was during the last HPV vaccination where we witnessed so much rejection and vaccine resistance. So we persuade the decision maker in the family. It may be the husband or the mother-in-laws. And we explain to them about the benefits of HPV vaccine and vaccine generally. And they agreed. Thank you. And we are able to vaccinate all the students in the school, all the eligible children in the community.
Thank you for sharing, Kafayat. Who shall we hear from next, Charlotte?
We have Amadou Musa, brother, whose microphone is already unmuted as well. Over to you, Amadou, and please do introduce yourself.
My name is Amadou Musa from Sanga Local Government Area of Kaduna State. Actually, the challenging being faced by many of the challenges we are actually facing. People have fear of unknown, which are being the major challenge, because we need to educate our rural people. Some of the rural dwellers do not even have ideas on what vaccination is all about and the importance of vaccination on their children. So they hardly accept the vaccine without being educated. We actually try to educate the people through the community leaders, the religious leaders, and the traditional rulers. So these people are the ones that are always in contact with the masses or with the rural dwellers. So educating them through those people is very, very important, and this is what we are trying to do. So majorly, the challenges is being reduced. We are reducing the challenges on daily basis, but truly it has been a very, very difficult moment for us. This is actually the situation on ground.
Hello.
Thank you.
Thank you very much indeed, Amadou Musa. Now, we do have Dr. Onobugu, who is one of our guides on the side, who also has a hand raised. We're going to turn to you, Dr. Onobugu. It's a great pleasure, and we're honored that you've accepted the invitation to support participants in the collaborative as a guide on the side. We're going to hear from at least one more participant, Charlotte, and then we'll go to Dr. Onobugu. Please, Charlotte, who shall we hear from next?
We have Dominion Bassi, whose microphone is unmuted, rather. Dominion Bassi, over to you. If not, James Ode.
Hello.
Yes, please go ahead, Dominion. The floor is yours. We'd like to know. Yeah, we have the question, what we call question number one.
My name is Dominion Bassi.
Can you introduce yourself and tell us about a time when you tried something new, different, to solve a problem in your community?
So far, we have been able to
yes, please go ahead.
to assess challenges through sharing. Hearing me?
No, unfortunately, Dominion, I believe there's a delay with your microphone. We're going to go to Ethel Okoro. And please do check your connectivity and a microphone before you request to speak. You can also type your messages in the chat, or if you are on watching through social media, you can also access in this way. Ethel Okoro, please, the floor is yours. Can you introduce yourself and tell us about a time when you tried a new way, something different to solve a problem, an immunization problem faced in your community?
All right. Good evening. Can you hear me?
Loud and clear. Please go ahead.
All right. Can you hear me?
Loud and clear still.
All right. My name is Ethel Okoro from Enugu State. Can you hear me?
Yes, continue. It's other people are unmuting their microphones. You can safely ignore them, please.
All right. Okay. Here in Enugu State, like during the COVID-19 pandemic, there was this hesitancy in acceptance of vaccination, especially so much rumors going out there on social media. Many people rejected it. So what we did, using social behavioral change approach, we met most of the religious leaders, community leaders, explained what the vaccination is all about. And anytime we come in a very large gathering, we'll ask those people that have already gotten the vaccination to share their experiences. You find out that form that has so many women coming together during August for community development, they discover that many have taken this vaccination, but they are scared to share their experiences. So when they open up, share their experiences, I have been vaccinated, people were like, wow. So this.
All right, that's really okay. I think we've lost. Okay, and we again appreciate
experiences really encouraged many to.
Go ahead. We're losing you, Ethel. You're coming in and out. If you can speak close to your microphone and make sure you're not moving around to make sure your connectivity is maintained. It sounds like a remarkable story that you're telling, but we want to make sure we get all of it.
Okay, what I mean was that share of experiences. We urge people that have taken this vaccination to share their experiences, and that motivated many to be part of it in my community here in Enugu State. Thank you.
Thank you very much, Ethel. And we again urge participants to check your connectivity and check your microphone in particular. Make sure that you can try with a friend and make sure that they can hear you and you can hear them. And then you should be okay for an event like this one. Otherwise, you may have a remarkable story to tell, but unfortunately, we will not be able to hear it. And again, we are hearing some of the stories in response to this question one, but we have just published the first collection of experiences shared in the Nigeria Movement for Immunization Agenda 2030 Collaborative. And this is a partnership of the Geneva Learning Foundation with UNICEF and NPHCDA. And you will find a remarkable number of testimonials, experiences shared. This is a new kind of evidence that complements quantitative and existing forms of qualitative evidence to reflect and analyze how things work at the local level. And that will be very much at the heart of what we'll be focusing on at the in the collaborative, starting with the first exercise tomorrow. Now, Dr. Onubogu has been very patient, and as we said in the opening, the focus on this event is really listening to the voices and experiences of health workers. Dr. Onubogu, a warm welcome to you. Please do introduce yourself to the participants, and then tell us what is on your mind as you've been listening to these first few voices that we've heard.
Good evening, everyone. I'm Dr. Onubogu. I'm a pediatrician. I work in Nayuth Newi, Anambra State, and I'm the chair of the Maternal and Child Health Committee of the Medical Women Association of Nigeria. During the recently concluded HPV vaccine rollout, we did a lot of work in monitoring, first of all, sensitizing the public and then monitoring the vaccine. And then in Anambra State, where I live, initially, despite all the sensitizations, we faced serious vaccine rejection. And this is coming from different, even the professionals, the educated, non-educated, from almost every sectors of the community. And so what we did, I discovered that when I'm talking to people, and I share personal experiences of my children being vaccinated, they tend to get interested and it tends to convince them. So what I did was to take photographs of myself getting my child vaccinated, and then also ask colleagues who have vaccinated their children to get photographs of their children being vaccinated. And we shared these photographs widely across Nigeria, across the states, all the platforms. And in Anambra State, this move helped a lot in convincing people that these people that are talking about it, about this thing, they are not only talking about it, they are equally getting their children vaccinated. And that helped to convince them to vaccinate their children. And even there's this conspiracy theory that in the South, people from the North want to, eliminate people from the South through the vaccine. So we got pictures of children getting vaccinated in the North, and we posted it to the South. And that kind of convinced them that this vaccination is taking place in every part of this country, that there's no plan to eliminate or harm certain people. So that helped a lot. So just like the other speaker said, sharing experiences, especially by healthcare workers, showing that we are doing what we are preaching, goes a long way to convince people. Thank you very much.
Thank you very much indeed. All right, well, we're now going to, in fact, recognize all of those of you who have already shared your experiences. And we honor contributors who do this. Now, we may have many questions. In some cases, we read an experience and it leaves us with more questions than answers. We wondered what actually happened. But the fact that you took the time to share something that you did and what happened and how it turned out is significant. And on the 1st of July, so just 3 weeks ago, 18 Nigerian health professionals had answered the first question that we asked. This went to 140 a week later, 273 last week, and today it is now 377 who have shared their insights. So we're going to take a moment to show you the names and of those who shared their experiences. We've actually published today the collection of experiences with 270. A lot have come in since, and you can see the names here. If you're on your phone, you're going to have to magnify to get to it, but we hope you can still see it. All right, there's several screens. We're going to take time to go through it. We'll see. And you'll see every state represented, and over 300 local government areas from all over Nigeria. Now, today's the launch event. This is the celebration. Tomorrow we begin to work together. We know that there will be fewer participants who attend in order to begin to work together on root cause analysis. But whether or not you're able to attend tomorrow, and we hope that you are, your participation, your contribution is valued. So if you see your name, we do expect you to speak up, because we're going to ask you the first question again. This experience, this launch event today is about hearing your voices. And even before we begin to work, we know that you are creative. We know that you are innovative, because you have to, out of necessity, you have to figure out how to make do with what you have when you need to reach children and make sure that they're protected from vaccine preventable diseases. So Charlotte, back to you. Really looking forward to hearing more voices. We've seen so many, hundreds have already contributed. Who shall we hear from next today in the launch event?
Already we have Musa Alassane. Musa Alassane, your mic is open. Are you able to answer to the first question? And please do start by introducing yourself. We have many other raised hands that I'm also.
Musa Al-Hassan, this is your chance. So I hope you do not miss it.
Hello.
Yes,
Hello.
Musa Al-Hassan.
Musa, over to you.
Yeah, we're waiting for you
Yeah.
to tell us about a time when you tried a new or creative way to solve a problem in your community.
Yeah, hello, good evening, everyone. My name is Musa Al Hassan, UNICEF as Social and Behavior Change Facilitator, LBC, overseeing 2 LGA, which is Zurmi and Shinkafi LGA in Zamfara State, Nigeria. In the case of immunization, most of the challenges, most especially issue of non-compliance, those that are rejecting vaccination, maybe during polio or RI, there are some issue we encounter, most especially during OBR round, last April round, which we experienced some of the non-compliance in some part of LGAs in Zamfara State. So there are some strategies that UNICEF came up with, which is engagement of medical doctors. This engagement of medical doctors has improved the resolution of many massive non-compliance in most of the LGAs. That is to resolve pending non-compliance, to make sure that maybe subsequent round there won't be another rejection of maybe polio vaccination or other RI vaccination at the health facility. So engagement of medical doctors and midwifery. We all know that how medical doctors are very close to the people in the community, and how some of the medical doctors helps the community in terms of medication, in terms of assistance and other related health-related issue. And we all know how most of our midwives, how they assist caregivers, maybe during delivery and other health-related issue. So that is why UNICEF came up with these strategies of engaging those medical doctors and midwifery to resolve non-compliance, which is doctors know how to come across those issues and engage those caregivers. Even
Charlotte, at least I've lost Musa Al Hassan.
Most especially the household. So they are the one that
We've lost him again, Reda.
access to the health facility due to some other reasons. Other reasons may be.
Thank you, Musa Al Hassan. I think we got the gist of it in a very specific description in time and place, and some of the things that you did are carried out. Charlotte, who shall we hear from next? And again, we encourage you to check your connectivity. You can call a friend using Zoom or WhatsApp. Make sure that they can hear you and you can hear them, to make sure this doesn't happen to you. We know many of you, in particular our guests of honor, have given a lot of thought and reflection to what you wanted to say today. So don't let technology get in the way. Go ahead, Charlotte. Who shall we hear from next? I see some very, very interesting experiences being shared in the chat as well.
Vivian Ben Obiagu, over to you.
Hello, good evening, everyone. Hello, can you hear me?
Yes, we can hear you. Please go ahead, introduce yourself and answer the questions.
Okay, I'm Vivian Ben Obiagu from Delta State, Nigeria. I'm a community health worker attached to an organization, Beteva Foundation. It's a very wonderful experience working with immunization team as a supervisor to various immunization activity in my LGA. We encounter a lot of issues, mostly refusal due to lack of trust for the vaccine, fear. Most of the committee members, they feel this is a medium. The government wants to reduce population, but it's a very serious issue. What we do during those periods, like this last HPV vaccine that was carried out, what we did was to actually go around. The first day we tried, it didn't work. We had to go around again to stakeholders, to school heads, pastors, talk to them, even try to give our own younger ones the vaccine in their presence to show that it's safe for us to give our children, means that it's safe for us. I even try to convince mothers, if you can come to the health facility and vaccinate your kids during immunization, then it's just the same thing. that there is no difference. So we try to convince them that it's safe for them to take it. And when they see that conviction that is actually true, some of them, they accept and allow their children to be vaccinated. So that is just the strategy we took. Thank you very much.
Thank you very much indeed, Vivian. And today is a celebration. Today is the launch event. We're not going to discuss or explore or deep dive into any of these experiences. They all deserve more questions to better understand the situation, what happened and what you did. But that is not our purpose today. So thank you, Vivian. Charlotte, back to you. We're going to try to hear from as many participants in the Immunization Collaborative as we possibly can today. And then tomorrow, we will start the first work session. And there, each story we will dive into and explore and really try to identify the root causes to get to the root causes. Muaz Haliru, the floor is yours. Can you tell us about a time, introduce yourself, and then tell us about a time when you tried something different to solve a problem in your community?
Okay, good evening, sir. Good afternoon, good evening, depending on where you are. My name is Muaz Haliru, a student from Infection Prevention Control. I'm in Kano Teaching Hospital, Kano. My challenge is the low vaccination coverage in urban slum, most especially urban slum in Kano State. The experience I would like to share is one strategy that will solve the issue of low coverage and the rejection of vaccination, which is giving incentives to the mothers. You can see that there are facilities that are used to distribute incentives to the mothers. Even the mothers don't want to accept the vaccination, they will go for it because of these incentives. Like during routine immunization, they used to give 1,000 as transportation or distribution of what gifts like baby clothes, soap, or pampers. This will make the mothers, you will see how they will be rushing to receive this vaccination. And I think this issue, this will resolve the issue of the rejection in vaccination. Thank you.
All right, I'm sure incentives will be on the agenda for the discussions, and there are, of course, limitations and concerns and considerations when thinking about incentives, as well as all the other possible local solutions. Think about something new, something creative, where you solve the problem in your community. That is what we are doing today, and trying to hear from as many of you as possible. Charlotte?
Yes, Reda, we have, before we listen to Umar Haliwu, I just wanted to also specially greet those who are answering the questions in the chat and inviting others to have a look, because there are some interesting insights and experiences that are being shared in the chat. So Umar Haliwu Jawahid, the mic is unmuted. Over to you.
Okay. Good afternoon. How are you doing at work? Hello, can you hear me?
Yes, we can hear you. Please go ahead and introduce yourself.
Yes, my name is Umar Ali Join. I am former field officer in New Incentives All Babies I call. The thing I would like to say now is there is communities where they are very hard to reach. So they are facing some challenges. They are facing some immunization challenges. So you have to consider it in the next target of this collaboration. Hello.
Yes, we hear you. And please, just for all participants, as long as you've checked your connectivity before, you should be fine. You don't need to ask if we can hear you. We hear you. If we don't hear you, we will say so. Thank you.
Okay. So there is many communities where they are very hard to reach. Like when I was in field officer in Bauchi, there is many communities where they are facing hard to reach. Where you can even pass a river before you reach that community, they are facing immunization. So you have to consider that things.
All right, I think, unfortunately, we have had a number of speakers today. You can see who did not correctly prepare. And therefore, even though there may be some very interesting experiences that they wanted to share, we haven't been able to hear them. Charlotte, let's give it one more try. We've got only 8 minutes left. So please, and for those of you who haven't figured out how to raise your hand, look for the little hand icon. It's probably too late, but remember, tomorrow you can join us, and there we will begin to share experiences. You'll break up into small groups and meet colleagues from all over Nigeria. Tomorrow's session is the one you do not want to miss after the launch event. Charlotte, shall we hear, is it Josephine Alex Abedo that we shall hear from next?
Yes, Reda,
Hi.
it's Josephine. Yes,
Okay.
Josephine.
Hi. Yeah. My name is Dr. Josephine Alex Abedo. I work with Nigeria Institute for Trypanosomiasis and Onchocerciasis Research. I have participated in the immunization program some years ago. And currently, I deal with a lot of people in the community. And some of the challenges, what I feel that how we can make people to embrace or to participate properly to embrace immunization is by involving the community health workers. Because the health workers, the community people, they have so much confidence in the health workers, especially the ones working in the community. And those health workers, I think they need to be sensitized on the immunization programs, the importance, so that they will now inform the community members on the importance of receiving this immunization, because they rely so much on it. They have such confidence, great confidence on their, health workers or the focal people in the community. So by doing so, because I go out most of the times to evaluate the status of onchocerciasis in community, and we have to use invasive method to check the status of this disease. So most of all, we have to involve the health workers right from the ministry, from the local government, down to the community level. And by so doing, they are open up to us to do whatever we want to do, especially to carry out our activities. So this, I have seen that whatever you want to do, you involve the community people, let them embrace it. It is there. You make it, present it to them that it is, they are supposed, it is important for them, the importance of the vaccine or immunization. So I think that is another way forward. Thank you.
Thank you very much indeed. So 5 minutes left. Charlotte, I can't believe it's already been almost 1 hour. Want to recognize the message from Bolatito and Felicia. And I believe we have had a number of the guides on the side in attendance today, as well as dignitaries, senior officials from many of the Nigerian immunization and health partners. As we explained in the opening, we made a deliberate choice today to focus on the voices of health workers, because tomorrow this group over 3,000 health leaders from all over Nigeria, all states, over 300 local government areas will be coming together for what we call the General Assembly and for discovery. So this is, if you are pursuing this program, today is the celebration and tomorrow the work begins. You can see what we will be doing tomorrow. Everyone who has applied and been accepted into the program should have received the instructions to join. Charlotte, I believe you wanted now to turn to our guides on the side, those who are in attendance, for a closing word. So we did not prepare or plan for this, but it does seem like after having heard a very diverse range of experiences, we'd like to start with UNICEF. So we have a number of colleagues from UNICEF who are with us in the panel who've been listening to your voices, your experiences. And I'd like to ask who would like to speak on the and share your thoughts, your reflections before we close this launch event and get ready for tomorrow's first discovery session. All right, we'd like to ask.
Rida, should I come in?
Yes, please. So Dr. Ibrahim Dadari, a warm welcome to you. Please do introduce yourself and tell us what are your thoughts after hearing these very varied and diverse voices.
Yeah, it's so exciting. I'm Dr. Ibrahim Dadari, immunization specialist based in our New York office in UNICEF. It's really exciting to see the numbers, 81,000 as part of the network, hundreds of partners. I think this is great, covering half of the LGAs in the country. Let's see how we can swing into more action to be able to reduce the number of zero-dose children. As you know, Nigeria has the largest, 2 million plus. So with this vast network and all the innovative ideas, I think we can get there very soon. Thank you so much.
Thank you very much. So Ibrahim Dadari works at the global level. I would like to turn to Kshitish Joshi from UNICEF Nigeria. Kshitish, if you'd like to say a word, and your first, just really what emotions an event like this made you feel. As Ibrahim said, starting tomorrow, we'll be digging into the work and the challenges to get to the root causes of these challenges. Otherwise, to go to Deepa Pokarel, who leads the demand for vaccination team at UNICEF. Deepa, yes, go ahead, Kshitish.
Hi, Reda. Thank you so much. One word: overwhelming, excited, and really looking forward to it. It's like really humbling, and you know, it's fantastic to hear so much of wealth of knowledge that's out there, the experiences and the commitment of the whole health team and people out in Nigeria. So I'm really looking forward to be part of this whole process and learn from all of you. I mean, it's been this 1 hour has been such a fantastic opportunity for all of us in terms of really listening to all of you and kind of ideas you have, the things that you would like to do, and you know, making the difference, bringing about the changes in Nigeria. And we're all in it together, and I'm really looking forward to the whole process and working with all of you in future. But thank you guys, really a big shout out to Reda team and everybody who's logged in. Thanks.
Wonderful. Thank you very much, Kshitish Joshi from the UNICEF Nigeria office. And tomorrow the work begins. Today is the celebration, celebrating coming together around the need, the urgency of reaching every child so that no child is left behind. That's the goal of Immunization Agenda 2030. Perhaps we can hear from Deepa Pokarel before we close. Deepa,
Thanks, Reda and Charles. I think my colleagues have said it. Ibrahim and Kshitish have already spoken about it. And Charles is also, Kakairi, who's my colleague here, is also online. But we are so excited about it. It's been such an humbling experience to hear from the health workers in Nigeria, from all levels, from the community level to the national level to the sub-national level. Colleagues, it's really been such a learning experience for us, and we really wish you all the best for starting from tomorrow to look at what you come up with as an action plan, and all the best. And thank you so much, Reda and Charlotte, for the wonderful work you've done.
Thank you very much. Our partners, we honor and recognize and appreciate their support and participation. We chose to focus on your voices, health professionals from all over Nigeria, and we asked partners to listen. They did, and you can see the impact that it has had. We remind you the shared experiences is available. It's in your inbox if you have registered or applied for the collaborative, whether or not you have been accepted. We look forward to your participation. The work begins tomorrow, and we very much look forward to that. I think now we're going to do what we call a rewind, where we'll show some of the most, actually in this case, some of the most recent messages that have come in and continue to come in from our Zoom studio, as well as all over the social media as we're broadcasting, live streaming on Facebook, Twitter, X, YouTube, Facebook, and a few others, and LinkedIn as well. Thank you very much indeed for joining us today, and we'll see you tomorrow when the work begins. All right, the messages keep coming. This is your last chance. We're going to close in about a minute. We are over time, so we know some of you need to go back to your daily duties. If so, please do not delay, do not be late because of the collaborative. We look forward to seeing you tomorrow when the work begins.
Bye-bye, brother. So beautiful. Bye.
We won't leave until the messages stop coming. I think that's the way to do it. We want to honor the commitment of each and every one of you. Still over 147 people left in the room. So as long as you're here, we're going to keep sharing your messages. But we do need to end this live stream and save your energy for tomorrow when the work begins.